Hi everyone! I hope you've all had a good week and that your studying is coming along well for the MBCOT exam. Today I'm going to talk about the difference between a top-down and a bottom-up approach. I got a question this week from someone who wanted to understand the extent to how we should study for this for the exam, and here's my answer. As with many things I talk about, don't focus so much on the definition, but understand them conceptually and know how they impact your reasoning in selecting the best assessment and intervention. Let's start by talking about a top-down approach, which, by the way, is favored in our profession. And that is because a top-down approach evaluation will always begin, the inquiry will always begin with what is important to the client. It takes a holistic and a very client-centered approach to first determine the occupation, the role that the client wants to return to or wants to continue. The foundational skills, the deficits, the client factors are then considered later. Okay, so starting with the broadest, the occupation that the client wants to perform is using a client or using a top-down approach versus looking at specific deficits or skills that the client must remediate or restore to perform, to engage back in occupation is a bottom-up approach. A bottom-up approach adheres more to the traditional medical model, so a lot of biomechanical approaches will use a bottom-up approach. So increasing your range of motion, increasing your strength and endurance, using physical agent modalities in order to reduce the stiffness. These are bottom-up approaches because you're looking at ways, specific ways to restore and remediate so that the client can get back to functioning. Versus a top-down approach understands that a lost function may sometimes not be regained. And this is what I love about occupational therapy. Regardless of the limitations and deficits, there is compensation, environmental modification, and adaptive equipment and strategies in order for that person to still thrive fully, to maximize functional independence. And so we don't look at the specific deficits first. We look at what is it that you want to do? What is the role that you want to do that is meaningful to you? And based on that, we create assessments or we administer assessments and intervention strategies to get them back to doing what they want to do. That is a top-down approach, okay? Let me give a real-life example. You have a child diagnosed with ASD, autism, and the child is not able to perform successfully in the classroom and is unable to participate socially. Now, will you as a therapist work on only remediation and restoration of the characteristics of autism? And is that possible? Probably not. But is the successful performance as a student, the child is a student, as a student in his role possible? Yes, because there are modifications that can be made in the classroom. There are adaptive equipments and tools that the student can use to enhance learning despite his inability to sit still, despite his inability to look and pay attention. You can provide strategies that will still allow for successful participation and engagement. And this is what helps us to be creative, right? Because we always have to come up with creative ways to help a student or a patient get back into maximal functional performance. This is looking at a top-down approach. So I hope that helps you understand the difference between a top-down versus a bottom-up approach. A bottom-up approach often will use a biomechanical model versus a top-down approach. Think about a rehabilitation model, right? Where you understand that remediation just may not be possible, but you are still getting them back to what they want to do despite their limitations. Okay? 4 minutes. These videos are always so much longer than what I want them to be. I always aim to do 2-minute videos so that I don't lose your attention, but hopefully that helps you understand the difference between two different approaches and how you should think about them when you're going through the different frameworks and practice contexts. All right? Okay, I'll see you guys next time. Bye.